Mr. Houston, welcome to the council.
Thank you. Good afternoon, Council or Chairperson Silverman, Chairperson Bonds, Councilmember White. My name is Thomas Houston, and I am here today representing Medici Road, which is a DC-based think tank, thank you very much for that, which actually seeks to reduce generational poverty by actually going beyond policy and looking at programs and products that actually work right now to reduce poverty. And so I'm here today to comment on Bill 22-178. Now, since moving to DC in 1995 as a freshman at Howard University, I've either seen or heard about all of the change that DC has gone through. Now, the 80s was all about jobs for everyone. When you look at the beginning of the early 2000s, economic and city infrastructure are building that set the stage for where we are as a city right now. When you look at excuse me, the late 21st century, DC really started to focus in on what education looks like for the city. Now, all of these solve a very specific problem, but when you relate that to poverty, that's a solution in a bubble. Often we look at poverty as an economic issue. Those who aren't in poverty, and even sometimes those of us who are in the industry, will point to EBT, free or reduced housing, free lunches, WIC, et cetera, as a drain on the economy. And this thinking, unfortunately, creates an assumption that giving someone a job will remove him or her from poverty. Well, our research and other data proves that that is not only not sustainable, but it's also not scalable across the city. So truly being scalable means connecting the dots. For example, in 2012, Zipcar came and partnered with DC Housing Authority to bring the Zipcar vehicles to public housing. And the idea was that they would be able to bring transportation to those who needed it. So in theory, it helped to rectify transportation, emergency child care, job interviews, and the food desert. However, in practice, the people who actually wanted to rent the car didn't even have credit cards to be able to rent the vehicles. And so when you look at, by connecting the dots, the commission will actually be able to view poverty reduction in a 360 vantage point and offer solutions that cross over multiple systemic issues. Well, what we think creating the dots looks like is, for example, creating an affordable housing program where residents can actually buy housing instead of just rent, or working on retirement saving ideas for residents who have little to no disposable income. Now, this is the type of innovation that this commission needs. Now, we're biased because these are the programs that Medici Road is actually working on. However, what you see is a program of not just new ideas, but also ideas that are currently being funded. And this helps to maximize not only brain power and ideas, but also is respectful of the current tax bases. To understand the approach that they should take, the committee actually needs to understand the different types of poverty. What's included in the official commentary there, the 4 basic types of poverty, DC really has 2 issues. When you look at relative poverty, which is your middle income, and then your generational poverty, which are your really low and systemic issues around poverty. Because of these 2, and DC having 2 issues around poverty, we are really advocating the City Council pass a very robust version of Bill 22-178. We're also recommending 3 ideas to consider in the development of the commission. The first one is to, right now there's 5 policy advocates, and so we're actually recommending to either increase that number or mandate that the commission include non-represented members of those communities once the committee is finalized, and that would be university, impact investment, affordable housing, public health, banking, faith-based, and youth or young adults. The second one is hire a grant writer. I actually worked with Richmond, Virginia's Poverty Commission, and what they found was after they did the research and created the recommendations, they didn't have enough money to actually implement it. And so since we know that this commission will be researching, creating, and implementing, let's go ahead and find non-local dollars in the beginning. The third, would actually recommend to create some kind of term with renewals based on results. Just an example, the committee can create a period of 6 years where the renewal is based on reducing the expense to income ratio by 3%, for example. Poverty is sexy. It creates sound bites, evokes emotion, and creates jobs for a whole bunch of white-collar workers. But poverty is life, and we think it doesn't affect us, but in reality, every time you see somebody crossing the street and conveniently happen to have a text message come through, it affects us. And so if it evokes some type of feeling, then it will affect us. The poverty reduction is a political football and would take serious political capital to say something like, why don't we not do something else to fix this, or let's raise taxes so we can do everything at the same exact time. And so my question is, are we willing to do either of those? And we recommend that the council work with the mayor and the commission to actually get them directed to take a stance so we're not having the same conversation again in 10 years. I thank you for listening to me today, and Medici Road thanks you very much in advance for having listened to these words and having the heart as you make this bill.
Thank you so much, Mr. Houston.
Mr. Houston, what do you think about the membership? Have you given thought to what this membership and how we would recruit this membership?
Yes, absolutely. And I would say we're actually doing some research in DC right now, and you'd be surprised how many people who live in Ward 6, 7, and 8 say, I want to share, but nobody asked me. And so what you've heard across the table already is that literally we don't have to spend money going to find people. There's organizations that work across the city already who are in contact on a daily, weekly basis with residents. And if we just ask them, they will give us a plethora of information, and we just have to figure out the time to sift through it and find the ones that work for us. On top of that, adding them to the commission, but literally just ask. You'd be surprised how many times we just don't ask and assume.
All right. Now, very quickly, can we talk a minute about the types of studies that you see the commission dealing with and bringing forth for public consumption?
Absolutely. So one of the things we looked at was, and just one thing we also found the Richmond Poverty Commission is, we spent a whole bunch of time doing primary research on stuff that everybody already knew. Yes. Things that other organizations have already done, like literally us and other organizations are doing primary research, so why spend money to go and do it again? We'll give it to you. Yep. And so there's a piece of sifting through that, it's called secondary research, but I would not spend time doing primary research on stuff that we already know. Where now when you start talking about primary research, you can look at, after we sifted through the secondary data, we want to see how is it specific to your area. And now we're having conversations around your area, and that becomes the primary data that you're doing. And I wouldn't necessarily look at it from a ward specific, I would look at it from a lifestyle specific, because there are people who live in the wards 1, 3, and 7 who have the similar lifestyle. So don't look at it from a ward, look at it from a lifestyle specific standpoint. But that's the way you can maximize your dollars and get the most robust information. And that's basically public-private partnership. Again, just go back to asking who are the other partner organizations who already have the research or already doing it, who'll be willing to share it with the commission for free.
Mr. Houston, you said that simply giving someone a job would not remove someone from poverty. Can you expand on that?
Sure. What we've seen when you look at, I just use TANF as an example. The idea of TANF is you typically have to work in order to get funds. Well, some people will say, well, I can get the same amount of money by hustling or doing something else, and I don't necessarily have to go to work every day. Also, poverty mostly is a mindset. And there's a mindset that's connected to health. There's a mindset that's related to lifestyle consumption. And just giving somebody a job doesn't teach them how to write a check or how to balance a checkbook. It doesn't teach them all the other aspects that go into poverty. And so just the job by itself is a short-term solution that works for some, but if we're talking about systemic poverty, it doesn't change. In the opinions of my testimony, it's like a monthly breakdown of what it costs to live in DC. All those components are really what you need to look at in terms of getting out of poverty long term, and getting a job will not get people even close long term. Anything less than $60,000 a year.
Mr. Houston, you mentioned that you are an advisor or member of the Richmond Poverty Commission.
Yeah, so
this is Richmond, Virginia?
Richmond, Virginia, yes.
Okay, can you tell us what you thought were the successes, what we should take from that commission, and perhaps things that you think we can improve upon? Sure,
I would say one of the biggest successes I thought was they had some version of a strategic plan in place ahead of time and said, this is our goals, this is our objective and our goals and what we're trying to achieve. Another big success I thought was they had, I want to say, a 30 or 40 person commission, and they broke that commission down into committees, so transportation, healthcare, et cetera. And that was based off of the overall strategic plan and what they wanted to accomplish. I think what they did not do well is they said, when all this is said and done, we want to actually hire a executive director. They probably should have hired the executive director first so that the executive director can give input on the plan that he's going to be asked to execute. Another thing I think they didn't necessarily do a good job of is, which is their government. So oftentimes government asks people to come to them to give feedback about a plan that's supposed to help them, instead of going to them and asking for input on a plan that's supposed to help them. I think had they probably done those two things, the other thing, they didn't have a budget for implementation. A lot of money for research, a lot of money for plan creation, but no money for implementation, and literally had to beg for a website to be created to communicate the action plan. And so two things done well, and then the other three things they could have done well was the budget, hiring an executive director early on, and then going to the community to get feedback.
Now, there is no time limit on this commission. Should the commission be time limited or in perpetuity?
I think it should be a combination, which is what we put in our commentary. There's, to your point, no sunset on any of the commissions. But what you're going to see happen is for the first two, 3 years max, all hands on deck to make this work. And because there's once the report comes out, you slowly start to see it die off. So if you, on top of that, say there's a time limit before renewal, whatever that time limit is, you will be able to see not only funding, but also personnel and time resources input to continue to make sure you see not 3 years, but let's say the time is 6 years, 6 years of work. And in order for this to get renewed, you have to produce not just a report, but some type of actual impact. And you'll be able to see continued work through that time period. Everybody knows as long as you're doing the work well, it'll get renewed. But just to say you can go as long as you want to, you're going to start to see it die off after the report comes out.